is an American board-certified endocrinologist from Chicago. She moved from the US to India 10 years ago, I think it was, and took up consultants' jobs at the Hinduja and Breach Candy. And then against the grain, she chose to leave hospital practice, setting up her own clinic called Asan, which I think when I asked her a few days ago means teacher. She is what I would call a truly holistic physician who would rather spend time treating the root cause of a problem than prescribing 100 drugs hastily and providing a quick fix in that way. She will address this crucial question of nutrition and answer every Indian patient's favorite question. So, doctor, what do I eat? So, Roshani, you have 20 minutes.
Thanks, Zarir, and thanks to Abbott for having me here. I was very inspired by the previous speakers, Dr. Mashru and Dr. Bhatt. I'm reassured that there are family physicians like you guys still around, and the primary care system still works. So thank you for that. I'll start. Okay, so let's get started. So of course, I'm not a frontliner. As Dr. Udvadia said, I have moved to a completely outpatient practice, but my practice does involve people with diabetes, obesity, hypertension, and insulin resistance. So I've been looking at it from that angle, that we know a little bit about what prognosticates worse outcome, whether it's morbidity or mortality. My role today is to show the connection between nutrition and insulin resistance and maybe this inflammatory process. So some early data from Wuhan, this is from the month of May, which showed a marker called the TYG index, which you calculate by fasting triglycerides, multiply by fasting glucose, and you divide by 2. You don't need to get worried about the math. The higher the triglycerides and the glucose, the higher your index. And they found in this Wuhan group that the higher this number was, the patients were doing worse across 3 tertiles, whether they looked at morbidity or mortality. Patients were actually doing much worse as the tertiles went higher. So this was statistically significant. It, of course, doesn't point to causation. It was merely a correlation, but it was a strong correlation. When they adjusted for other inflammatory markers like CRP and TNF-alpha, this connection went away. So we don't think it's TYG index by itself. There's obviously a lot happening besides insulin resistance alone, but maybe what ties it together is the inflammatory response. And my role here, the way I'm looking at this is, we don't yet know how to adjust CRP, TNF-alpha, or the cytokine storm through nutrition, but we know a lot about how to manage triglycerides and glucose through nutrition. So that's going to be the focus of my talk. What do we know about triglycerides? Again, and I'm going to keep flashing the formula there so you remember why we're coming back to these markers. We know the cardiovascular risk profile that comes with high triglycerides. It's definitely not a healthy marker to have from a metabolic perspective. How do triglycerides affect cardiovascular health? These are the mechanisms we think are at play: endothelial dysfunction, inflammation through cytokines, and coagulation. And these happen to be the same things that look like they're happening in COVID. And all you frontline physicians will know that better than I do. But from the textbook connection, this seems to be a connection between triglycerides and maybe some of the inflammatory response in COVID as well. So, but triglycerides are easily modifiable with nutrition. So what's the first thing I need to show you? This is the only endocrine slide I need to show you. This kind of ties together inflammation, nutrition, and endocrinology. So up on the top, it's dietary sugar, which is fructose, dietary carbohydrates, which will raise your insulin levels naturally. Now insulin has a lipoprotective effect, so you can't burn fat. Your body has to start burning sugar when you are exposed to insulin. So it's a very paradoxical thing that happens, is that you take in sugar, you have high triglycerides now because you're not able to burn the fat, and you have high sugars as well when you get into a vicious cycle of insulin resistance. So this is not healthy. And the unfortunate side effects of this are the uric acid goes high, reactive oxygen species, fatty liver starts to happen at the level of the liver, and all of these markers tie to inflammation, insulin resistance. Now, I'm holding this slide for one more second because a lot of times when we see a high uric acid in India, the patient will be told to stop eating their pulses. And again, from a vegetarian protein perspective, pulses become an important thing. So if you want to affect uric acid, really what you need to be doing is reducing sugar and reducing carbohydrates. There's a direct link between fructose and uric acid. But for the point of corona and COVID today, the thing I wanted to talk about was the link with carbohydrates and triglycerides. Now, how can you affect the sugar levels, fasting sugar levels, as that was one of the correlations with bad COVID outcomes? What can you do from nutrition to affect glucose levels? That's an easy one. We know that from the world of diabetes. Okay, so again, this is the American Diabetes Association document. It comes out every January. It's a reliable manuscript to look at for what's new in diabetes care. This is a 2020 document. And I won't read this difficult piece of paper to you, but it's the medical nutrition therapy for diabetes. And in summary, what it says is going low carbohydrate or very low carbohydrate naturally brings your blood sugars down while reducing your diabetes medication. So this is an accepted way of treating diabetes. This is science. Okay, so going low carb helps you bring the blood sugars down. And when they talk about what carbohydrates, they use the word whole foods. Watch that word though, because I'm going to talk about whole foods versus whole grains and how we get a bit trapped up with that. Again, avoiding the added sugars and refined carbohydrates. It sounds obvious, and yet all of us struggle with reducing the sugar in our diet, don't we? So then how much carbohydrate? How low should my carbohydrate go? This is a 2019 document for people with diabetes or pre-diabetes, where the amount of carbohydrate you need is actually unknown. We don't know how much carbohydrate you need. There's actually no number because the body has plenty of mechanisms to create energy from breaking down glycogen, gluconeogenesis. If there's no more carbohydrate, it'll burn fat, burn protein, convert it into glucose, ketones if it's a very low carbohydrate intake. So there's really no essential carbohydrate. The way we know about essential fatty acids and essential amino acids, there's no essential sugar which needs to be consumed. Glucose is necessary at the cellular level, but the body has all the backups in place to make glucose within. So you don't need to be fed glucose to keep your energy levels up. What about processed food? And what about coronavirus? And what about insulin resistance? So this came out this month, October 2020, where they looked at the New York public health data on COVID, and they found that the processed food related non-communicable diseases, all the chronic diseases that are in my world, type 2 diabetes, obesity, hypertension, fatty liver, who have the common link of insulin resistance, those are directly correlating to worse outcomes in COVID. Now, I understand that, as Dr. Mashru said, there's a lot of other things you have to focus on when you're in a pandemic. This is not the time that you're going to go and solve the economic divide and social problems and world problems of chronic disease and all the inequalities that create this chronic issue. I need to focus on oxygen levels and keeping this person alive. So lifestyle change is not for now. Well, what if I told you that adding or taking away sugar from someone's diet can have a positive or a negative effect in as little as 9 to 21 days? Sugar can cause measurable harm in 21 days. This was a randomized controlled trial, diabetes care. This was the approximate amount of fructose given to a person. It's not a lot. There were no pastries or cakes or anything. It was stuff that you might even consider healthy: muesli, a juice, not even a soda beverage, one fruit, tablespoon of honey, about three biscuits, the equivalent of that amount of fructose. And in 21 days, this study, they were able to make healthy men unhealthy. The triglycerides went up in 21 days, and they developed insulin resistance on the gold standard tests. Okay, this was a very interesting trial, RCT, where they could cause harm by giving fructose in 21 days. More relevant for today's talk and for our patients who are experiencing COVID is stopping sugar has been shown to have a measurable benefit in 9 days. This was Dr. Robert Lustig, a pioneer in the battle against sugar. And this was a study he did where they did isocaloric fructose restriction. So they kept the carbohydrates the same. They just replaced sugar with starch. So this was not even a low carb study. They basically just took out sugar in the form of fructose from high-risk children, Latino, African-American high-risk children. They took the sugar out, and in just 9 days, the triglycerides came down, OGTs improved, oral glucose tolerance tests improved, hyperinsulinemia improved, all statistically significant. Weight came down in just 9 days. In fact, one of the study requirements was to keep the children's weight constant so that that wouldn't falsely give the benefits on triglycerides and insulin. So they had to struggle to maintain these kids' weight for those 9 days because they rapidly started losing weight when they took away the sugar. So when we are dealing with a pandemic with no curve in sight and no cure in sight, 9 days is pretty short. And why wait for that PCR test to come positive and the call comes to the doctor? Should I start worrying now? How about before the cause for worry starts? 9 days starting today, why aren't we taking the sugar out, processed food out, and get this benefit into everybody's homes? So, what are the steps you can take? Where can you start working to get sugar and fructose out of your diet? Let's talk about that now in terms of practical things. If you want to remove sugar from your diet, you have to be very careful because the food industry knows and they have found multiple ways. I've put with the red arrow some of the traps in the Indian market. A lot of people feel that coconut sugar, dates, dried fruit, like dried anjeer, that's a sugar that is preferable in some way. Jaggery, honey, they think is okay. Fruit juices, they think are okay. Like, oh, this patient has an illness, let's give them juice to keep their energy up. You're giving them sugar. High fructose corn syrup, of course, you'll read on the package labels and you'll know. And again, jaggery, these are all sugar and they all have fructose in them. Now, you're obviously, all of you are physicians on this group. This is not going to fool you when you read a label of ketchup. It says made with 100% real tomatoes. I mean, I don't know what's a 60% real tomato, but it says 100% real tomato and it says fresh tomato on the pack. And, I think you know the difference between this and a fresh tomato. When you read the ingredients, it's now tomato paste and sugar, preservatives and stabilizers. And for every 15 grams of ketchup, there's 5 grams of sugar in ketchup. Okay. So it's important to read these labels when you're removing packaged food from your house. I have this objection from patients all the time, but mine is whole grain. I bought whole grain. So let's look at what whole grain labeling actually means. When you eat something which in Indian kitchen is considered light, and even our hospitals do this, they serve idli and poha and upma. Idli is from rice, but if you look at a whole grain of rice and you look at an idli, a lot of processing has happened to convert the grain. So it's no longer a whole grain or a whole food anymore. It used to be a whole grain. Upma, shira, and wheat flour, refined flour versus the whole kernel of wheat. People think makhanas are okay, those lotus seeds. But, I had to go watch a YouTube video. The number of steps required to take a lotus seed and turn it into a ready-to-eat instant food. Ragi khakras and ragi biscuits, people think these are diet foods, that they are gluten-free. Yes, they're gluten-free, but they are not low carbohydrate. And again, look at the comparison with the whole ragi millet. So here's a way you could get confused with a box. This box has tried very hard to make you think you're making a healthy choice. They've written whole grain in 3 places on the front of the box. And I magnified this. Again, it says 100% of the grain is whole grain. I don't even know what this means. It's probably, if you're busy, you'll just say it sounds like it's whole grain. Let me just buy it, right? Who can even analyze this? And when you read the back, this is a ready-to-eat cereal, right? So it says brown rice flakes. Now it's not saying whole grain rice. I showed you the picture. They have a picture of whole grain rice on their box, but that's not what's inside the box. You have rice flakes, which you can pour milk or you can have it straight away without even chewing it. They have jowar flakes. And whole grain jowar looks very different, ready to eat for somebody else, not you and me. Oats, again, whole grain oats are at the top. That's a whole oat. And a processed oat, all these other pictures are pictures of various ways you can process oat. But only the top one is the whole grain. So be careful when you're buying whole grain. It should look like a whole grain. Otherwise, it has been processed. And the way it affects your carbohydrates and insulin is going to be much faster. You're going to have a much faster insulin and glucose response to processed grain. So what can you do? You'll say, I don't buy packaged food. I don't buy box food. My patient has COVID. I'm going to feed them from my kitchen. What should I do from my house? All right, so let's talk about that. Throw out the processed food, packaged food, soda. You're not going to give your family soda when they're sick. Let's look at home food. Cut your carbohydrates to half. Whatever is the menu, if you are taking 4 chapatis per day, cut it to 2. Replace that space in their stomach if they're feeling hungry with more dal, more vegetable. It's the same menu. It's tur dal, it's bhindi, it's roti. go half on the roti, go double on the protein, the dal and the sabji. This person probably will not be left hungry with this much food on their plate. What about fats? We want more healthy fats. Again, remembering from that insulin pathway I showed you, it's eating carbohydrates that raises fatty acids in the blood and raises triglycerides. Eating fats actually causes less of an insulin response. So by eating fat, you don't raise your blood fat. By eating carbohydrates, you increase your inflammatory blood fats. So the way to reduce that is to prefer less processed, most natural form of healthy fats. And I'm not going to read all these things out, but I'll make one comment is dry fruits. You know, people will say dry fruits. When I say dry fruits, I mean dried cranberries, dried dates, dried apricots, and dried raisins, okay, dried grapes. Those are fruits. Those have fructose. That's not in healthy fats. I'm talking about nuts. So in India, because you buy the nuts and dry fruits from the same shop, they think nuts are dry fruits. Please keep those two things separate. Dried fruits are rich in fructose, very high in fructose, and nuts are a healthy fat and source of protein. Again, we're trying to avoid all these processed fats. If the budget allows, again, we are talking to a pan-India audience today, so I'm sure there are people from all over the country. If the patient's budget allows at home, there are a little bit more expensive fats that can be added to the pantry, which would give more satiety and have less of an insulin response. Protein is a very big one. I have 3 minutes left. Most of the Indian kitchens have insufficient protein going into their diet. So when we say that go from insufficient to normal, we're just bringing them from about 0.3 on an average. When I talk to my patients, they're getting about 0.3 grams of protein per kg. Let's talk about a 60 kg person or a reference body weight of 60 kg. They need about 48 to 60 grams of protein a day. So I'm just asking them to come to normal. Why? Because you will be full. You will not require to go for carbohydrates to fill your stomach, and you will be more satisfied with less of an insulin response. So no, we're not asking you to go high protein. We are just asking you for normal. And actually, when you look at the target from the Western perspective, 0.8 is a low protein diet, not a high protein diet. So Indians get worried, oh, this is a high protein diet. It's higher than where you were, but I'm bringing you to normal. Please understand the maths going on here. These are some examples of plant-based proteins that you can add through the day. You will need to be working more consciously as a vegetarian to make sure you get enough plant-based protein at each meal. It's a little easier when you're okay with animal-based protein. This is one portion of a deck of cards. Like if you see a deck of 52 playing cards, palm-sized piece of boneless meat will give you about 25 grams of protein per serving. If someone says, but I'll get gassy, I'll get flatulence with pulses and beans, I can't tolerate it, it's too heavy, reassure them it's a new thing in your diet. Your gut bacteria has to get used to it. There are new carbohydrates, complex sugars in there, fiber. So the government is changing in your gut, and that tends to raise a stink. You know that when governments are going through change, it causes a lot of stink. So you need to pay attention to that and reassure your patients that adding protein is going to be okay. I'm just flashing this slide just so you can quickly scan through. The middle column is what things you can increase in your favorite Indian meals and your variety. I'm Gujarati, and Gujaratis love to eat for variety. So when you want variety foods, how can you quickly increase the nutrition of the meal without compromising on the enjoyable factor or the experience factor? Put the rice as a garnish on the top. You don't need the bowl to start with rice at the bottom. Fill it with your dal and your gravy, your coconut curry. Use rice as a garnish. In summary, we're trying to keep insulin, glucose, and triglycerides low to reduce the inflammatory response. This is based in science, okay? Reduce the snacking if they're overweight, for sure. And again, avoiding the processed food. So last parting thoughts is, if someone eats like this because they're health conscious, constantly grazing, they're basically creating an insulin response through the day. This is chronic hyperinsulinemia by someone who's health conscious trying to eat throughout the day. Let's merge those meals and snacks, combine it so that you have time in between meals without so much insulin exposure. That will bring your glucose and triglyceride levels down. And here again, you put the proteins through the day for satiety and fullness, add enough healthy fats through the day. This is just a suggestion how you can go. And I'll leave you with a poem, because I like to write poetry once in a while. Is, in a sweet tooth world, where consumption is the norm, where sabji needs roti and an extra one if it's warm, where dal and sambar make sense with rice, where eating them alone cannot taste nice. Awaiting mask, vaccine, and drug to solve the infection. Insulin resistance and COVID, a mysterious connection. Let's go home this Sunday a little more wise, and low carb menus in our homes revise. And with that, I am happy to conclude. Thank you very much.
Thank you very much, Roshani. That was such an important and practical talk. You're also a gifted poet, not just a great endocrinologist. And I think there are important lessons here for us when our patients ask us what we need to do in terms of their nutrition. I'm going to stop chocolates for 9 days and move over to lotus seeds. You'll be happy to know, though they sound terrible.